Hey, good afternoon everyone, and welcome to Mini Hands with Montoya. Today I want to talk to everyone about radial longitudinal deficiency, formerly known as radial club hand. Radial club hand is outdated terminology, but you will still see it in many textbooks and occasionally hear it in the hospital setting. I have chosen this diagnosis as a start of this series because radial longitudinal deficiency is associated with hypoplastic thumbs. And since my capstone dives into orthosis fabrication for thumb pollicization, which is a surgery that can be done to address hypoplastic thumbs, I wanted to lay the groundwork for another commonly associated condition. So you're probably thinking, what is radial longitudinal deficiency? So let's break it down, make it pretty simple. So think of it like this. Radial is going to refer to the radial side of a kiddo's arm. Radial, radius. Longitudinal, think about longitudinal as long. Long correlates with length. So you're thinking the radius and something about their length. And then you have the word deficiency. So something's wrong with it. So when you break it down, radial longitudinal deficiency, the kiddo is going to have something wrong with the length of their radius. So what is radial longitudinal deficiency? It's a congenital condition that occurs by chance where the radius or bone is shortened or just gone. No one knows its exact occurrence, but it can be anywhere from 1 in 30,000 to 1 in 100,000 live births. It's pretty rare, and it includes a spectrum of abnormalities and varies on the presentation of the kiddo's thumb, metacarpal, scaphoid, trapezium, and whole radius. Typically, the ulna is also involved, and it's only about 60% of its normal length. So here's my forearm, fully grown, not getting any longer, any shorter, but if I was a kiddo that had this condition and now grew up to be an adult, here's about 50% of my ulna length. So I would probably be around here, and I'd have a pretty short forearm. As you can imagine, being an OT, this is obviously going to affect all their ADLs. All right, back to where we were. The entire bone can be missing from their forearm or even both their forearms, so they could have bilateral involvement, and muscles and nerves can be missing as well. And on top of all that, remember, they have a short, oftentimes curved forearm. So a kiddo with this diagnosis is going to have other problems on top of this. They need to have a complete physical workup by their pediatrician due to other syndromes that will need close monitoring. These syndromes can include, but are not limited to, congenital heart disease, congenital scoliosis, and blood dyscrasias. As an OT, one of the main impacts you're going to look at and treat is the kid's wrist. You're going to be looking at their wrist range of motion because their wrist will rest in radial deviation and appear really curved. In a couple seconds, I'll post some pictures and some videos so you guys can get a little more in-depth view of what this looks like.
Like a cereal bowl.
For these kids, OT is going to begin within the first few months of life in order to lay the groundwork for complex surgeries. Initially, OT begins with gentle passive range of motion at the wrist to prevent an extreme radial deviation contracture. Additionally, as an OT, you're looking at the child's ADLs, dependent on their age, seeing if there's any adaptive equipment or modifications you can do to help them engage in
I'm
their
about to bring my colors
looking at their development,
and I will
range
bring
of
in the
motion
bag
of
and
bilateral upper extremities, joints, as well as their thumb positioning and movement. Okay, let's get back to the wrist. It's crooked, right? They're little, they're tiny, you get this kiddo, and they simply have a really crooked wrist. What are you going to do? Make a splint. Fabricate an orthosis. This is to stretch the wrist into ulnar deviation and prevent a radial deviation contracture. Because remember, they have a short radius or no radius at all, and the splint is going to be used to correct this. You're going to have the kid don this only at night That way the little ones can still develop their hand skills during the day. All right, so a little bit more on the purpose of this splint. It centers the carpus on the wrist. Think of your carpus like an ice cream and forearm as the cone. If the ice cream cone is tilted, the ice cream is eventually going to fall off. The orthosis keeps the ice cream or your carpus from falling off the ulna. Here's a little visual demo. Here is your ulna and radius. But remember, this is a normal forearm with a radius and ulna. Normal length. Here is your carpus. It's nice and centered. Ice cream's not going anywhere. It's right on the cone. But if you're a little kiddo with radial longitudinal deficiency, you either have an absent radius or a shortened radius, like this. So what's going to happen? That ice cream is going to just want to start falling off. This is the carpus one more time. This is the kiddo's ulna. This part down here is their tiny little radius. And oh no, the carpus, it's falling, it's falling, it's falling. Make a splint. All right. So, one more time. Splint only at night. They need to use their fine motor skills during the day and develop their hand movement as well as their palmar arches depending on their age. And the splint is really just going to keep their carpus centered on the ulna. This splint is just the first of many that they will wear throughout their development. Since kids continuously grow and grow and grow and grow, sometimes they need a new splint in 2 weeks because they just grew out of the other one. And you're like, okay, here we go again. It's the same splint every time. And you can always make it unique or dress it up depending on the kiddo's personality. That way you'll increase their wear adherence. So that's pretty much it for my little chit chat on radial longitudinal deficiency. Stay tuned for the next video in my series that will discuss children that have radial longitudinal deficiency and hypoplastic thumbs. And remember, there's no correlation between thumb hypoplasia and radius involvement, but the two diagnoses are associated with each other. So just because someone has radial longitudinal deficiency doesn't mean they'll have a hypoplastic thumb, but they can. All right, see you guys next time on Mini Hands with Montoya.